Welcome everyone and happy Tuesday. Thank you for joining us for the January edition of the Trauma webinar series. My name is Bree, I'm the education lead for Trauma Nova Scotia, and I will be your moderator. We are lucky to be joined today by Dr. Stephanie Smith. Dr. Stephanie Smith has been in the military for 22 years and has been working as a family medicine physician since 2021. She was previously a critical care nursing officer and deployed twice to Afghanistan, as well as to the Philippines with Disaster Assistance Response Team. She loves to teach and has also developed a simulation program that reinforces leadership and resiliency skills to medical students, residents, physicians, and allied healthcare professionals. She loves snowboarding and competing in triathlons, as well as spending time with her little munchkin, Shaylee, who keeps her very busy. So without any further ado, I'll let Stephanie continue. If you guys have any questions, just type them in the questions box. Stephanie will answer them as she goes through her presentation. If there's any left over that haven't been answered, I'll read them out at the end.
Excellent. Thank you so much, and hope we don't have any technical difficulties, but appreciate, Brianne, all the work you did to make sure this could happen today. And I'm excited to join you all. So unfortunately, you don't get to see me, so I added in a couple of pictures of who I am. So at least then if we ever meet, you can know who I was, and hopefully we can connect about some of the topics that I bring up today. But really excited to join you. I've met a couple of the people attending here when I presented for Dow a couple of months ago, and really excited to bring this material to you guys. So you can see from the pictures on the screen right now, there is a picture of Road to Mental Readiness, which is essentially a lot of the topics that are brought up today come from that training that I took as a facilitator in 2012. And then since that time, when I went back to medical school, developed another course using some of those skill sets, and then linked it with my passion for simulation, as per the picture on the right, and then essentially developed a curriculum that you could use by learning different skill sets that could help you manage the stressful events we're exposed to. And you can do it in multiple modalities, whether it's high fidelity simulation, role-playing scenario, actor-led scenarios, trainers, whatnot. Essentially, today we won't be able to do the application of the stuff you're going to learn, but hopefully you can see how these skills can be applied in those training environments, but also in real life practice. And then we'll still go over some other things that you can do after you do the simulation as well. So essentially this course today, hopefully, or this overview of the course, is really going to have a focus on shifting from surviving in the work that we do to really thriving in the chaos. And I'm going to take us to the next slide. Hopefully I just press click. I'll see. Sorry, I'm not techie. Okay, good. I threw in a picture there of my little one and I wanted to highlight. Somehow I've lost the PowerPoint. I'll bring it back. Sorry. Wanted to highlight some of the references and resources I've used over the years. So I did a master's in disaster and emergency management in 2010 to 2012 and interviewed 100 participants, 50 paramedics and 50 nurses, and looked at the psychological implications of not feeling prepared when we deploy to war or disaster environments. And from that, learned a lot about how it impacts our mental health, our wellness, and then essentially developed the resiliency course and readiness course to help combat some of those negative impacts that happen to people when we didn't feel prepared. So hopefully some of those things will translate well for you. And then I also wanted to highlight, I take a lot of my presentation material from Brene Brown. I've read her book on Dare to Lead and Rising Strong. If you haven't had a chance, they're great books, and really speak a lot about how we can lead in really chaotic and stressful situations. And then I took an Oxford Women's Leadership Development Program a couple of years ago, and it really spoke about how we can shift and use our different leadership styles. And then as well, I recently took Harvard's Debriefing with Good Judgment course, which is a great course for anybody that's really interested in doing a debriefing and feedback sessions with either learners or your team. And then also took the Royal College Simulation Educator Training course, which speaks to all things simulation, but also really speaks to debriefing and providing feedback as well. So those are some things I wanted to highlight, and hopefully some of those will resonate with you. So essentially, why strive? So I've mentioned a bit about the why, but also the background I have with deploying in different environments. I found that there were many people that came back that had some negative consequences associated with the deployments. And I really was passionate about developing a tool that could help people feel better prepared, and really not only so that we could perform better, but that we could also really enjoy the job that we were doing. And it's interesting because when I know working in Afghanistan, there was obviously a lot of trauma we were seeing regularly, and we were just embedded with a very new team for 6 months of time. But I found working in those environments that by really setting the stage with doing really good preparedness training in teams, led the teams to work more effectively together and really allowed people to develop their leadership skills and be able to adapt them well within those stressful environments. So some people will bring up, though, why do we need resiliency training? And to such an extent that I thought about changing the STRIVE acronym to be, simulated training for readiness, because really it is getting people ready for the stressful experiences that we have in the jobs that we do. But really, when we think of resilience, it's giving you a toolkit of skills so that you can navigate stressful situations. And people will often say, though, like, just fix the system. That is the issue. And I like to highlight that even if we worked in the utopian environment where we had all the resources we could possibly have, we're well paid, we've slept, we've eaten, we are essentially looking after our basic ADLs, and we're making sure that we are working in teams that we like, and we essentially like to go to work. It's even better than being at home. It's that great. In that perfect place, we still are going to be dealing with death and dying. We're going to have stresses from our patients, from their families. We're going to have stresses amongst ourselves. So realistically, even if we can still fix the system, which hopefully we will, at some point, we still need these skills to help us navigate it. And ideally, we develop these skills early on in training so that we can model them for others, help teach our peers, and also like lead by example. And so we essentially develop that effective approach to stress management and leading teams. And really, people look to us to lead teams, regardless of what role you're in. You don't have to be the designated leader, if you will. So you don't have to be the trauma team leader, or you don't need to be the lead paramedic. You're still within that team, look to be a leader amongst whether it's the families or the patients, or even within your team. We all need to be effective at being able to handle our stress and be able to help that team be functioning as best as it can. And I think another important reason we bring up resiliency is also identifying and recognizing resources. So when I teach this course in person, I always get people to shout out different resources that they like. Feel free to write them in the chat. So one resource could be, for example, I live in New Brunswick, so through the New Brunswick Medical Society, I can reach out and get resources. So if I needed to talk to a psychologist or a psychiatrist, or I needed relationship counseling, or my partner needed support, whatnot, I can reach out and get those resources. But then there's other resources like using apps like Headspace or Mindshift. And just bringing those things up can be really helpful. So if you have any tools that you like to use that you find are helpful, feel free to write those in the chat for others to benefit. And I think it gives us a space to say that there are resources out there. We need to know what they are so people are more likely to reach out and to use those. And knowing what they are makes you more likely also to promote them to your peers and feel like you have some tools to help others. And we do this for our patients a lot, but we can also do it within our teams. So today we're going to go over, if you had seen the objectives that we were going to review today, it's essentially looking at the impacts of stress on our wellness and our mental health, then linking it into, and that's essentially looking at, emotional intelligence and looking at our self-awareness piece. Then we lead into our self-management piece and learning some resiliency skills, the Big 4+, which is developed from the military's Road to Mental Readiness training that was adapted from the Navy SEALs that looked at how we could manage stress in highly stressful environments in war, and find there's a very good overlap in the stresses that we deal with in the healthcare system. The third piece is looking at how we can integrate using a compassionate leadership framework into the stressful environments we're in. And the very last piece is really linking into what we colloquially have used the term debriefing, and looking at really doing constant feedback compassionately and doing check-ins with our teams on a regular basis, and kind of shifting a little bit from that formalized debriefing approach. So before I keep going, just looking in the chat to make sure there aren't any questions. All right, I'll just keep plugging in. So essentially, if you were to look at the news or you watch the news, we can see there's lots of examples of the stress of our healthcare system, whether we're looking at paramedics at the front line, picking up patients, feeling jammed, being able to constantly going from one call to the next, or getting stuck in the system, waiting in the emerge department, or feeling like we do not have the ability to care for the patients that we have that are critically ill, that are getting stuck in our emergency departments, or even just having that constant need to provide care even outside of the normal environment in the patient waiting room now, or in the hallways. I just read an article actually today out of Nova Scotia that said over the weekend that someone had not been able to provide care in the the general area where you actually assess patients. So all of these things significantly impact our ability to feel well and do the job that we do. So it adds that stress, and it really speaks to the system challenges, as I previously mentioned. However, we know that we can develop some skills that can help us ideally navigate these stressful environments. So we also can speak to some of the data that's coming out as well. And it looks at the last slide, sorry, just that the Canadian Medical Association actually did a survey and indicated that there's significant burnout and stress that's happening amongst physicians. And I think we can easily deduct that that is translating over to nurses and paramedics and all members of the team. And so here, just speaking to, I know I'm speaking of the doom and gloom that's happening, but I wanted to highlight it's not just happening in the Atlantic regions, it's happening across the country. We have closures, we have the inability to provide the care that we signed up to do. And essentially, if you want to see some data on this, I was able to find some specifically related to physicians, but I like it because it breaks it down into the specialty area, which really is indicative of the environment that you work. And if we're looking at this, unfortunately, whether you're in emergency or critical care, which really most of you, I assume, on the call probably work in those environments, whether it's pre-hospital or in-hospital care. And so unfortunately, we're seeing rates of like 60, 56% for burnout. And this also is interesting because when you look at the data that was done pre-COVID, we had rates of around 30 to 40%. There was quite a good amount of literature that came out amongst nurses at that time, and they found that it was in those ranges. And now post-COVID, we're seeing significantly higher rates of burnout. So just good for us to recognize, which we probably know, but just looking at the data, it can indicate that as well. And then linking back to that Canadian Medical Association data, I thought these numbers really stood out to me because I think that while it speaks to what physicians are experiencing or learners are experiencing, I think because it's speaking to the environments which we work in, I would assume it translates as well to the rest of the team. But it's looking at essentially like 80% of physicians and learners were not feeling fulfilled in the jobs that they do. And like I said, I really think that translates over to our other professions in those environments. And then we also indicated that 8 out of 10 were experiencing harassment or bullying or intimidation. So this really speaks to why we really need to incorporate this compassionate leadership style so that we can have people feeling more satisfied in the work that they do and feeling more psychologically safe, which we will speak about later in the lecture. So I'm sure all of you know what burnout is, and I don't need to beat a dead horse with the burnout triangle, but what I really love about this slide is it takes the Maslow hierarchy of needs, and I want you to reflect and think for a moment if you've ever been providing care for a patient and you feel like your bladder is going to explode. Or you can feel it like grumbling in your tummy because you're starving because you haven't eaten and you're going from one call to the next or one patient to the next, and you haven't even been able to look after yourself, right? So many of you, I probably would imagine, would agree that you've experienced some of those things. And I think this just really highlights, because when we're not meeting our own basic needs, it can really make it very challenging for us to be empathetic, kind, and supportive to the patients that we serve. And really what's neat is when we look at the hierarchy of needs and we translate that with the Maslow's driver of burnout, they really kind of connect with them. But I wanted to highlight them because they really link to a lot of the psychological conditions that develop from the stress that we're exposed to. And they certainly highlight the importance of some of the skills you can bring in as a compassionate leader. So just reflecting on some of these drivers of burnout, if you've ever felt there's conflicting values. So sometimes the system itself is developed in a way that you want to do something, but it limits you from being able to achieve that. Some of the other conflicting values that have come out during COVID is wanting to provide families the opportunity to be with the patient and having limitations because of that. And that can link in as well to like the absence of fairness. It can seem very unfair to the families and the patients that we're treating, and then also puts very significant challenges on us. And also that breakdown of community, that inability to be able to connect with one another because of the situational challenges. Another one I like to bring up, which is one we can really impact, is that insufficient reward. And so whether it's monetary reward or recognition, there are ways that we can help. And so whether that's giving extra financial remuneration for people when they're putting themselves in harm's way, or whether that's recognizing people for the work that they do, those can really help negate the impacts of burnout. Another one that's really important is that lack of control or autonomy, and really making sure that within our roles, we're able to fully work within our scope and feeling fulfilled within those roles. And then the last one, really, I mean, it speaks to it itself: work overload, having too much work to do when you're on your shift, working too many hours, and not feeling you get that respite when you leave the work that you're doing. So I want you to remember these when we get to the compassionate leadership piece so that it can kind of translate together. I also like to highlight some other terms that when I was doing my master's research, I didn't really know what a lot of them were. I was hearing these stories that were coming from the paramedics and nurses I was interviewing, but I like to highlight a lot of the data and research comes out around burnout. I mean, it's pretty easy to do surveys related to that. You can use the Maslow burnout inventory to do studies on it, but there are other things we should call out for what they are. And some of those would be compassion fatigue. So if you're caring constantly and always giving of yourself, it can be very exhausting. Another one that's really important to think of is imposter syndrome, and that as we are expected to do more and more, it can feel more overwhelming, that we are not prepared to do the job that we do. I remember actually learning about this going to medical school and feeling like, did they accidentally pick me to go to med school? Like, did something happen and I got lucky, like the files fell on the ground and someone grabbed mine and thought, oh, it was supposed to be considered? And it's just interesting because when I got to med school, I found many of my peers had felt the same way. And I think there's an expectation of us that we want to do the best job we can do, but we can be very hard on ourselves. And I think learning about imposter syndrome and recognizing it can be very key. And we'll talk a bit about that in the positive self-talk section. And then another one that I think is important to bring up is institutional betrayal. And this is something that I talk about within the military settings. And that's like, if I have someone joining the military and I say, you're going to be infantry and your job is going to be to go camping all the time. Well, I'm kind of betraying I'm not establishing trust. I'm telling you you're going to go camping, but really you need to go away and fight in a war. Very different. Institutional betrayal might be in the healthcare setting, that you were told you're going to do a certain job. You're going to be given the resources to do that job safely. And then you are put in a situation that's completely contrary to that. So then you are essentially asked to work stretched thin in dangerous situations, and you're actually concerned that if any errors happen, you're probably going to get hung out to dry. Someone's going to get fired and you don't feel you're going to get support. So this is something that's certainly coming up more and more as our system gets stretched thin, because we don't feel we're getting loyally supported in that journey. And then the sanctuary trauma, I think, is one of the most important ones we can speak about. I talk about this with actually military sexual trauma a lot. So if there is a sexual trauma that happens and then you reach out and you speak to someone about it that you trust, and then they further traumatize you. For example, I've been sexually assaulted. I go to my physician and my physician says to me, well, you know, we always tell people you shouldn't go to this area of the city. Like, why would you go there? For an example. If we translate that to the work that we do, sanctuary trauma would be, I'm working in an environment that seems toxic. I'm feeling I'm bullied by someone, or there is an aggressive patient that always comes in and I feel unsafe. And then I go to someone who's in a leadership position that has the power to help me, to listen to me, and someone I trust. And they further traumatize me in the sense that they don't support me. And they say, you know, get over it. Everybody has to deal with this, or you're making it seem worse than it is. That would be an example of sanctuary trauma. So it's really linking that you have had a traumatic event or something is stressful in your life, and you're going to someone that you trust and they're not supporting you, and they essentially make it worse for you. And then the last one, and I know this sounds like doom and gloom, we're going to get to the positive, I swear, but I think it's good to be familiar with the terms, is second victim syndrome. And second victim syndrome is speaking to the fact that at least 50% of us are going to be exposed to an event where an error is going to happen, or an unintentional impact happens because a decision we have to make, there's no good option, and the patient has a poor outcome. And that is significant impacts on our psyche. So the Canadian Medical Professional Agency, I sat on the board as a resident, and this was the #1 reason they actually got calls from physicians, was concerns about when they have to make a tough decision and it doesn't necessarily have the best outcome for the patient. And they're concerned, you know, is this going to impact the patient and their family to the point where they're going to take litigation into consideration? And many of us can be concerned about that. And the next slide just brings up a couple high-level cases that have come up. And if we look at the bottom left here, it's interesting where the system failures impacted a pediatrician resident in the UK, where this little guy, a 6-year-old with Down syndrome, had come in and he ended up being septic, but he presented pretty much like a pneumonia, and the lab system was down. So when the blood work was ordered, the system didn't notify that there had been critical values, and there was no notification to the physician or the nurses that that patient had critical values. And there was some disconnection with new staff working on the floor. And essentially, the patient was permitted by the staff for the mother to give home medications, with multiple communication errors led to, unfortunately, the death of this patient. And there was litigation done, and this woman actually was on maternity leave being called into the police station to do an investigation. So quite significantly traumatizing if events like this happen, but with no intention of her own to make those errors and being stretched thin, the system can sometimes fail us. And then the other case in the middle there, the Libby Zion law, is a famous case out of New York City, where some residents were working and they were on their 20-something hour time frame on the shift. And unfortunately, a woman had come in who was the daughter of a very influential lawyer. And she actually was assumed to have psychosis. She was physically and medically restrained, and she ended up having serotonin syndrome, and she ended up coding and passing away. Fortunately, there was some law that was made to ensure that you couldn't have more than 80 hours of work per week to ensure medical error wouldn't happen, but another significant case. And most recently, Rodonda is a nurse here on the right-hand side out of the States, where she was treating a patient. She accidentally gave rocuronium instead of Versed on a patient that was going to CT scan that was anxious, and they ended up passing. And significant publicity has been around this case where this nurse and the team did not feel supported. So essentially, we can see that this is going to impact many of us. We need to talk about this and recognize that it's a reality, and then we can really use some of the skills that we can develop to help ourselves navigate and be kind to ourselves when these challenging situations happen, especially as our system gets stretched more thin. Like I said, it gets positive now, and I apologize if it feels like dreary, but we're going to shift into more fun stuff, I promise. So I want you to think about all the things I brought up. It might have stirred up some experiences you've had, and it might make you think about some of the stresses that you're experiencing in the work that you do. And I like to highlight here, before we get to the brain talk, what it feels like for you when you're stressed. Because recognizing how it feels for you is key. If you want to write in the chat, feel free. You can write something like, I feel tense in my shoulders, I feel nauseous, I get a headache, I find it difficulty to find thoughts, whatever you want. I'm just watching the chat and see if anything gets written in there. And nothing in the chat yet. So, and I assume everybody has the ability to write in the chat, Brianne, but I'll just keep going given that I don't hear anything, see anything there. So
yeah, everybody can write in the chat.
Okay, I figured with such a big group that someone would want to write in the chat. But some of the things that come up are ones that I've mentioned. Others have come up on courses I've taught where people have difficulty writing, so they actually elect to not be the recorder in a trauma, for example, because they find they make mistakes when they're writing and they get really overwhelmed. Some people find they're very black or white thinking instead of being able to look at the gray. Great. Someone wrote cranky. I get cranky. Awesome. Well, not awesome, but good that you're recognizing that you get cranky. And so it's good for us to notice how we respond in stress, because then we can notice how it makes our team respond. So if I get stressed and I get cranky, or I yell at people, or I'm very, directive with my approach and people find it intimidating, for example, then they're less likely to potentially speak up at what's happening in the group. So like recognizing that you do that is super helpful. So if we think about what happens with our brain when we're stressed, so if we look at the unstressed brain, my prefrontal cortex is able to recognize the environment that I'm in, and I'm able to have effective control over the things that I am thinking about, the feelings I'm having, and I can actually process through the actions I'm going to take. So for example, an unstressed might be, I have to go in and put an IV in a patient that's calm, not stressed about having the IV put in. I can have a conversation with them. It's not stressful. A stressful case would be, 5 of us having to hold down a pediatric patient. They're screaming, their parent is like, why are you hurting them? And we're trying to get an IV in. That would be an easy example of the shift. Well, what we want to have happen is that you recognize when you're feeling that stress response. So when I am stressed, naturally, my amygdala, my hindbrain, my primitive response takes over. My brain is hardwired to activate this part twice as fast. But what I can do is when it's activated, I can say, whoa, I've seen this before. I can recognize this, and I can really shift to my prefrontal cortex is the goal. And essentially, it also goes to our habitual responses. So amygdala just takes over and I have a habit of running and hiding. I'm going to run and hide until I recognize that's what I'm doing. So we have a weaker control over our thinking and retrieving data and our ability to regulate our emotions and our actions, where we might start being stressed and snapping at other people. So if we look at the next slide, it's just speaking to the fact that we can develop within our brain a filter. And so if you want to strengthen your filter, it's really your recognition. How I respond to stress, I want to change it in this environment, it's ineffective. Same thing if you're having an argument with a partner. If you can recognize your patterns and you're doing the same thing over and it's ineffective, you can shift yourself from that emotional response and your amygdala to the prefrontal cortex to take control and make effective decisions in that moment. And that's improved by learning different skills, practicing those skills, reinforcing that they are effective. And it's also impacted by our previous experiences, good and bad, because we can learn from those as well. So really the next few things we'll go over will teach you how to really strengthen that and buffer your filter. So, sorry, this is the, I think, last slide before we get to learning those skills. This is the check-in for yourself. So when you mentioned you might have some of those symptoms when you're feeling stressed, we can obviously develop chronic stress over time and they can start to impact different areas. You can be acutely stressed in the day. You can go into work that day and feel in the green. I'm super happy and feeling positive, and I'm in the green zone, if you will. The military created this so that people would use language that was not stigmatizing, like I'm feeling depressed or anxious. I'm feeling in the green zone, I'm feeling good, or I'm really overwhelmed right now, I'm in the yellow zone, or I'm in the orange zone, or I'm in the red zone. And it's not a continuum in the sense that you have to go from green to yellow to orange to red. I can go into work and everything is great. And then if I get a phone call from my babysitter that my daughter has just had a fall and she's being taken to hospital, for example, I could easily shift into be very farther past reacting. I could be so overwhelmed in that situation I can't focus at all, right? But if we have chronic stress over time, you can certainly see those shifts where you then start to function. Your normal zone becomes reacting and or injured. And I think the important thing here is to recognize there's different categories. If you look this up online, it's very detailed, looking into the changes that are different within each of the different categories. But I've broken it down into looking at if you have noticeable changes in your mood, attitude, and performance, your sleep. Is it restorative? So obviously, if you're working crazy shifts and you're getting poor sleep, that's one thing because you have an inability to get to sleep. But when you have the opportunity to have sleep, is it restorative, or are you ruminating, or are you finding it challenging to feel refreshed afterwards? Physical symptoms, are you starting to get sicker? Are you having specific ailments like that, muscle tension, headaches, things like that? Social behavior, are you finding that even though it might be limited because of a pandemic, for example, and you can't socialize as much, but when you have the opportunity to socialize, do you still feel the same satisfaction? And then lastly, are you using substances or gambling to cope with the stresses of the work that we are doing? So when you can recognize those things and being vulnerable to talk about, hey, I'm in the yellow or the orange or the red, is really allowing you to speak up and advocate for your mental health. But also recognizing you do not need all of these to be impacted. Just one can be significant enough to be impacting you and stretching you too thin. So we've covered all the initial emotional intelligence of the self-awareness, and we are going to the self-regulation piece, which is those take-home skills that you can use for yourself or your patients or your peers. I use this with patients all the time. I think it's one of the best tools I learned back in 2012. And hopefully you'll find them beneficial with your patients. And really to highlight the skills you're going to learn are speaking to mindful skills, resiliency skills, and there's evidence that shows if we use our emotional intelligence with mindful practice, we have an improved mental health for ourselves, patients have better outcomes, and that's because we create a space where people feel safe to speak up. We make our patients feel heard, we have less medical errors that happen, and we improve patient satisfaction and trust, which makes us all feel better. And we're also able to really activate our empathy. Interestingly, if we look at our brain on stress, we down-regulate the part of our brain that's empathetic when we're in a constant stress state. So people can say to you, be more empathetic, but if you're really stressed, it can be very challenging to activate that part of your brain. So the first one here is just talking about attention control. That is essentially saying that we are constantly shifting our attention during shifts. And if we can recognize when things are impacting our attention, it can be really helpful. I like to acknowledge that it's really a good reminder here to say we have a team, and some people in the team will notice the fine things and some people will notice the big picture things. So if you recognize within your team, hey, I normally see the big picture and I miss those things, you can say to your team, hey, is there anything else that I'm missing here? So an example of a shift might be you're doing a specific skill, you're transferring a patient from the scene, you have to do an intervention, and you might be monitoring the safety of that scene, but then you're also having to do a specific skill. I mean, you can only focus so much. So if you're doing that intervention, you've kind of lost control of the scene and you have to hand that to someone else or recognize that your attention is now shifted. So essentially, by learning some of these skills, we can allow ourselves to focus our attention on the specific skill and then be able to shift it back to big picture when we need to. Another example might be if you're the trauma team leader and then you're having to monitor multiple traumas coming in versus then being asked to do a technical skill. Maybe there's someone struggling to put in a chest tube and they need you to leave your role for a minute to go do that specific skill. Another example I find is when I'm doing CPR, I cannot think of anything else. So when I teach ACLS and we're going through the teams, and if I'm, for example, joining the team and doing CPR, that's all I'm thinking about, that's all I'm hearing. So it's just a reminder of it's very hard in the jobs that we do to maintain our attention. So doing constant check-ins to make sure that the whole team is aware of what's going on is very helpful. I'd love to watch the video, but I think due to time, I never have time to do it. We'll see if we have at the end, but it's the monkey business illusion. You know what, we'll just do it. We'll watch the monkey business illusion.
The monkey business illusion.
Can you hear it?
Count how many times the players wearing white pass the ball.
Brianne, can you hear it?
Yeah, we can hear it. And there's a few questions and comments that I can read off after this is done too.
Perfect. Sorry.
The correct answer is 16 passes. Did you spot the gorilla? For people who haven't seen or heard about a video like this before, about half missed the gorilla. If you knew about the gorilla, you probably saw it. But did you notice the curtain changing color or the player on the black team leaving the game? Let's rewind and watch it again. Here comes the gorilla, and there goes a player, and the curtain is changing from red to gold. When you're looking for a gorilla, you often miss other unexpected events. And that's the monkey business illusion.
Awesome. So hopefully that came through. And that just really highlights that hopefully you all saw the gorilla. I certainly missed the gorilla the first time. And I think it just highlights that some of us will notice those things and some of us won't. And it always reminds me that when I'm in a code situation and there's a lot going on, I will say, okay, let's just take a time out. I'm thinking this and this and this. Is there anything that I'm missing? And it really helps, one, create a space where the team is more likely to say something. And if I have missed something, it will be more likely to pick it up, hopefully. And I know there's questions I've been told in the chat, although I don't see anything after the last one I checked. So if you want to read those, Brianne, that would be great.
In the question section, people mostly listed their physical symptoms that they have related to stress in the workplace, including, like, most often in that kind of orange spectrum that you were talking about, pounding heart, sweating tight muscles, pain in chest, stressed migraines, tension in neck and shoulders, grinding teeth, startle easily, feeling angry, lack of appetite, have trouble focusing, head feels fuzzy, anxiety, nauseated, trouble sleeping. And then for anyone who is having trouble contributing to the chat, it's actually, especially if you're tuning in from a cell phone, it's under the questions section. You can type comments and questions.
Thank you so much for reading that. Yeah, I'm in questions and chat, and I have nothing in questions showing up, interestingly. So I will go to you check-ins regularly. Thanks, Brianne, or feel free to jump in whenever.
No problem.
So we're going to talk about some of the skills you can use when you're recognizing those symptoms that you guys have all shared, which is great. And that can be either considered box breathing or arousal control or tactical breathing. The military will refer to it. We know we can't bring our heart rate down or blood pressure down or our temperature by thinking about it, but fortunately we can with breathing. So the logic behind this is, as we take those nice deep diaphragmatic breaths, we stimulate the phrenic nerve and we stimulate kind of our parasympathetic nervous system in that response and help us calm ourselves down, improve our performance and our focus, and really help calm ourselves so that we can retrieve the data and information we need. I find this a great reset if I've had a negative interaction with a patient or a family that I'm trying my best with and they just do not seem satisfied with it. I find taking a couple deep breaths once I've left the room really helps me reset, especially when I need to go see another patient right away. And one strategy you can use, they call it the 16-second mindfulness, and that's the 4 seconds in, hold your breath for 4 seconds, breathe out for 4 seconds, and then keep your breath empty for 4 seconds. So let's just try that here. You can have your feet on the ground, shoulders back, eyes opened or closed. We're going to take a nice deep breath in for 1, 2, 3, 4. Hold it there for 1, 2, 3, 4. Breathing out 1, 2, 3, 4. Empty 1, 2, 3, 4. I find this really helpful when I work with my patients as well. Sometimes doing 4 breaths is like not possible for them, and it's just take a nice deep breath in and a nice deep breath out. When I work with pediatric patients and they're feeling really anxious or scared about something, I'll often tell them to think of like their birthday cake. I want them to take a nice big like smell in that birthday cake, and then I tell them to blow all the candles out. And so that can help with like imagery, and it can help calm them down as well. And the second one is, and we're kind of skimming through these, like if I teach a 4-hour workshop, we practice them a lot more, and hopefully you feel comfortable teaching people at the end. But if you have any questions for me about them more in detail, let me know. So the second one is cognitive reframing or positive self-talk, which is probably one of the most important ones. And that's really where you can shift your thinking. So it's recognizing that we have these kind of cognitive traps that happen. So some of us have extreme thinking. It's black or white. I always mess up, or I never can do this right. And we use really strong language, or we are very critical of ourselves, or we kind of, in a situation, we think the worst case scenario. One example is, you're in a situation, trying to intubate and you're struggling as a learner, and then, the anesthesiologist jumps in to assist. You might think as the learner that I'm an idiot, I'm messing this up, and the anesthetist might think, hey, this looks pretty hard. They're having a tough time. I want to help them and the patient. I'm going to jump in. So often we go into the negative in our own mind. So it's recognizing that, and an easy takeaway is catch it, challenge it, change it. So just catch that thought when you have it. Oh, I'm a complete idiot. I always mess up intubating. Challenge it. Well, actually, no, you've intubated before. You can do this. Change it is, when I'm stressed out, when I'm doing things, it's okay to ask for help, for example, or, things can be hard and I can get through it. Those would be ways to kind of reframe it. And then the other really important takeaway would be to consider what a friend would say. So often we can be really hard on ourselves. So if we were to tell them the story, can you believe how awful this was? They'd probably say, like, it's not that bad. Like, maybe you're being a bit hard on yourself. So just considering that as well. And the last would be a positive mantra. So whether a positive mantra for you is a word or a song or something that shifts you back into like a healthy, happy, green space. If I have an interaction with a patient, like I'd said, that's kind of a challenge and I feel like I'm trying my best and they're like yelling at me, or there's some negative interaction, I find more so maybe, let's say, with a family, you can't do enough right for them. I need to reset myself. Like, I need to be able to go into the next interaction and be the best that I can be. And having a positive mantra can be really helpful. I've learned a lot about this actually from working with OBS-GYN and teaching this workshop to them, because they give examples of, imagine you're going in to deliver a baby and you have a negative fetal outcome, and then you need to go down the hallway and deliver another baby and be happy. So you've had a very significant traumatic event, and then you need to go be happy immediately after. So certainly having a way to do that could be like, just do it, or you're good enough, or smile, have a sticker on your name tag, something like that. Feel free to write those in the chat as well. I always like that within groups to hear them, but mine often is like, you've gone through hard things, you can get through this. And then that just shifts your thinking again, getting out of that amygdala to the prefrontal cortex. I've got this, I can get through this. Or you're the best shot this patient has, be positive, So just really shifting yourself can be helpful. So whether it's true or not, if you tell yourself it, you'll probably believe it. So just shift it to the positive and make the experience better. The next one here is going over goal setting. You could use SMART goals, but I don't teach that anymore because I found everybody knew what SMART goals were. And an easy acronym to use is what's most important now. Again, a really simple phrase. When you're in a stressful situation, there's lots of chaos happening. We have people arguing, yelling at each other, whatever it might be. What's most important now? Or right now there's a lot going on. Let's work together and focus on resuscitating this patient, or let's focus on getting the blood work done, or whatever it might be. Just shifting people in that moment on what's most important now can be really helpful. The next one is visualization, and I think this tool is great. As an athlete myself, I've used visualization to prepare for races, but visualization, the key is to use all of your senses. Start easy, visualize a happy place that you enjoy to go that's super relaxing and puts you into that kind of out of that fight or flight reaction. And as you get better at doing it, you can use it for skills or interactions. So maybe you find it really hard when you deliver bad news. So you want to actually imagine delivering bad news and things going well. Then you can practice delivering it when someone gets upset. And then you can navigate those situations in your mind. And the synapses that are developed in your brain from visualizing are as effective as the ones you're doing in person. So it's very good for something that you can practice over and over again. Again, back to the intubation, I use this skill all the time to get me through my anesthesiology rotations so that I could navigate the challenging cases. And ideally, the goal is you've navigated it in your mind so that when it's stressful in real life, you can say, ha, I've seen this before, I can get through this, it's not so bad. A great example, a trauma surgeon told me when he took the course was that he would always use the scrub-in time for visualization. So he has a couple minutes, he doesn't ever know what to expect, and so he can't really prepare for mentally what the surgery is going to be like as well as he can when it's like a pre-planned surgery. So what he would do is just scrub in. He would imagine like the using his senses, what it looked like in the room, the brightness of the lights, the smell of the cautery tip, the feel of the gloves on his hands and the mask, and the tightness of that, and listening for when the nurse would do the check-in with the patient name and the staff that were there, and found that to be a very grounding technique. This is a Rouen-Y study that was done out of Toronto where they essentially took learners and they got them to practice doing visualization skills with the procedure. And those that did the visualization for a few weeks prior to doing procedure on this the pig cadavers, they did much better at doing the procedure from the technical skill standpoint, and they actually threw an anaphylactic reaction into the case, and those that had done the visualization training were able to navigate the extra stressor that happened in the surgery much better. So it's an example of using some sports psychology visualization to improve better outcomes in a clinical setting. And we're on our last one, which will be great for those of you that said you had some tension, you get headaches when you're stressed. So this is essentially practicing feeling the tension outside of a stressful state. This is a really good thing to help people sleep as well, I find, and it works for me. So it's a tense muscles for 5 to 10 seconds. You can start with your hands or your neck or wherever it is for you that you hold a lot of tension. So just do it now if you don't mind. Pick an area. I'll pick my hands. I'm going to squeeze them tight for 5, 4, 3, 2, 1. Relax and open. You can see the color coming back to your hands. You can do this through and have like an endorphin release that comes. The goal is that when you then feel that in a stressful situation, you recognize it. Hey, I'm feeling really tense right now. I need to take a couple deep breaths and flush it out. I don't recommend doing like the muscle tension practice in front of your patients. It might not be as great, but practicing this for those of you that really hold that tension can be really helpful so that your body recognizes it right away and you learn strategies to relax when you feel the tension. So that covers the quickly the resiliency or readiness tools, stress management tools. Does anybody have any questions? I'll go back to you, Brianne, because I don't see anything in the chat here.
We had a couple people share their mantras.
Oh, good. What are they?
Bring it on and embrace the suck.
Embrace the suck. I love it. And that's awesome. Bring it on. Those are great. So hopefully for you guys, if you didn't have one before, you'll pick one. I did an interview before when I was interviewing for emergency medicine, and they said, what would be your song that you would pick when you get into a stressful situation? And I was like, that's a great question. And it would be We Are the Champions, because I feel like if we have that positive pump up, bring the team together, you're more likely to be successful. So if the song works for you too, then that's great. But thanks for sharing those. So we're shifting to compassionate leadership. And essentially that's speaking to inspiring others with not only our head and our smarts, but also with our heart. And so you could look somewhere and find that like there's the 7 C's, for example. You could be contemplative, being able to take a step back and kind of think about things and taking a moment before making a decision. Being curious and wanting to explore. And that one can also, that curiosity can lead to you asking your team if there's any ideas they want to share. You know, being confident in situations and being confident with being vulnerable as well, and being okay to say, I'm confident enough to know that I don't know everything. And it's okay to be able to say that. Being compassionate and being able to really identify that piece of empathy and then taking it into action, which is what compassion is, and then being collaborative with the team, really speaking up within your team, and then really highlighting other people's voices to make sure they feel like they're part of the team. Being civil, being able to give respectful, direct feedback to someone in a kind way, and then being courageous, being able to really speak up in those tough times. So what I've done on the next few slides is I've integrated some of these ideas with some of the material that's come from Brene Brown and other leadership courses I've taken, and from my experience working in the military. And I think these are like the key things that'll really help us when we're trying to remind ourselves in those tough times to be compassionate. So really having self-awareness. So knowing where we're at on that day. If we're in the green zone, great. Just like we check our urine to see if we're dehydrated, we can check in and see how we're doing from a mental health wellness standpoint. And then really reminding ourselves we have to do what keeps us well. If we get stretched too thin and we start to take away the things that keep us well, we're not going to be able to be an effective team player or leader. One tip that's come out is, gratitude and saying 3 good things every day has been shown to be as effective as SSRIs in managing and helping with anxiety and depression. So just reflecting on the good things can help activate the part of our brain that stimulates empathy as well. And then probably the most important piece here, our self-awareness helps us reflect and manage our autopilot. We have developed our stress management strategies along the way. They may be good, they might be bad, but recognizing what we're doing and how it's impacting our team so that we can manage and adapt them will make us the most self-aware we can be and adapt us in any team environment that we're in. And feel free to add things in the chat again, I'll check in as well. Another one is being kind. So when studies have been done on what's one of the most favorite or most important things you see in a leader, it's that they are kind, that they are approachable. So figuring out how to, communicate with kindness and empathy, when you're feeling stretched thin and you're exhausted and you're dealing with the stresses of what we do, it can be very hard. So it's almost like reminding ourselves, where is this statement coming from? Is it coming from a kind place? Do I really need to say this? It can be challenging, but if we have those cues to remember, people really want the kindness. We expect that you're competent and capable of doing your job, but add in this extra piece. So really seeking to understand and listen to our patients and our peers. And I like to highlight here that we try to refrain from judgment. It's interesting because we judge others based on their behavior, but we judge ourselves based on intention. And so if I cut someone off in traffic unintentionally, I didn't mean to, I just didn't realize the exit was coming. I didn't know, I'm new to the area. But if someone else cuts me off in traffic and they're a jerk, why would they do that? They're so inconsiderate because they behaved that way. So it's just interesting to maybe take a step back when we easily judge people for doing the things that they do on maybe what their intention was. And then I'd like to highlight here, being kind to ourselves, having self-compassion. There's some good literature from Kirsten Neef as well about how important that is, and that we can be so hard on ourselves. And if we don't emphasize that self-compassion, we will not be able to be empathetic and kind to our patients or our peers. Empathy, extremely important that we can activate this part, and it's really shifting from being sympathetic to empathetic. So if you haven't seen this video, essentially sympathy drives disconnection, empathy drives connection, and sympathy is about saying, oh, that's really crappy, but I don't want to let myself in emotionally to feel what you're feeling. Empathy is coming down the ladder, meeting this person in their hole and saying, that sounds really tough. I don't really know what to say right now, but I'm really glad you shared with me. And I think acknowledging that ability to do that can be hard, but I wish I could show you this video, but I do think we might not have time for it. If we do, we'll come back to it, but you can look up Brene Brown, sympathy versus empathy. And this one I think is one of the key pieces here, because some of the literature will say compassionate leadership is essentially like being empathetic and compassionate and having good leadership skills. Well, I don't know about you, but when I went through training, although it was part of an expectation in the CanMed roles to be a good leader, I didn't learn specific leadership training when I went through medicine, and I don't even recall learning it a lot in the military. I've learned lessons along the way from great leaders and from bad leaders, but I think taking formalized leadership training or even taking a leadership quiz is super helpful. Just like knowing your Myers-Briggs personality, it's really helpful to know how you act in a leadership position. So adaptive leadership is really compassionate leadership. What type of leader do I need to be in this situation? So I've used some examples in these pictures here. You could use in some examples, they'll look at essentially being supportive or directive. So in some cases, you need to be more supportive and nurturing to people to help support them in the roles they're doing or coach them. But sometimes you need to be very direct with people and assertive, or the job won't get done. Your ability to know your natural leadership style and what you're comfortable in, and then be able to adapt other leadership styles is what makes you a great leader. And really being able to be vulnerable enough to acknowledge, hey, this isn't how I normally feel comfortable, but I've really got to shift to be more assertive in this situation to do the best job for the team, for my patient. That's what takes you to the next level as a leader. And so you can use Goldman's leadership styles if you like as well. If you want to know some, you can look them up, but essentially they will essentially shift you from being more authoritative to being more democratic, coaching, supportive in that journey. And essentially it shifts all the time. Some people I work with, I can be very supportive and coach them. And some other people I need to be very specific about what my expectations are. They want me to be direct, do not beat around the bush. So the key with this is seek feedback. Ask someone you trust. Hey, how do you think I am as a leader? Or what do you think I could work on? And what do I do well? And so you will learn what you do well that you might not even give yourself credit for. And then you can also learn your areas of improvement. But being vulnerable enough to put yourself out there is really where that growth happens. So the other piece here would be read the room. What does the team need from you right now? And what is going to make it worse for the situation? And really always lead by example. You can always be a kind leader, even when you're being directive, right? Even if you say you have to get this done, I know you want the best for the patient, let's pull together and do it. So I'd say this would be one of the more important ones is remembering, be adaptive as a leader, that is your job. And then we're obviously have to be supportive, and to be supportive to our team, you must feel supported. So if you don't feel like part of the team and you feel like an outsider, it's very hard for you to be supporting others. And really that links into getting a mentor, getting someone early on to help support you in that journey, and then become a mentor. So if you never had a mentor and you haven't considered it, reach out to someone that could help you in the role that you're doing. And then ideally be able to give back by being a mentor and really set people up for success. You know, if someone's fumbling doing something within the team and they're trying to do a skill, we're not wanting them to falter. We're not wanting them to be unsuccessful. We should support them. Are you struggling right now? Can I help you? And acknowledge that and be okay with that, because often we, I think, just let people hang to dry and say, well, it's their job to figure it out. You should know what to do. You know, help people get the job done by supporting them. Know your team and check in with them often. And I mean, you might be in a formal leadership position, or you might be working within the team. Ask the team, how are you doing? It's just like doing CPR. It's been 2 minutes. Do you want me to take over? You look tired. You know, you are reaching out and supporting your team. And really within that, it's providing supportive feedback. So often feedback will be looked at as positive or negative, but really it's not needing to be that. You can still provide supportive feedback that can help people grow and improve. And really what that looks like is, do you have an ability to provide appreciation in the moment? Hey, this is really hard what we do. Thanks for showing up. Thanks for working so hard. Or maybe I need to coach you in this situation and say, hey, I noticed that you were kind of struggling with that intubation. These are some things that I do that makes it a little bit easier. Or it's always okay to say, it's really hard for me to visualize right now. Can you take a look? It's okay to open up and be vulnerable. And even if it's in the evaluation place where you're actively like in a training environment where you're being evaluated, you can still say to someone, you're being formally evaluated, but I still want you to develop success in the job that you're doing. I want to support you in this. And there's a great book, I highly recommend you reading it, for Thanks for the Feedback. Even when it's off base, unfair, poorly delivered, and frankly, you're not in the mood, which I'm sure all of us have received feedback in the past that we have not even really wanted to consider because of the person delivering it or how they deliver it. But you can either read the full book, or you can get Blinkist, an app that'll allow you to read through the Coles Notes in 15 minutes. But I highly recommend it because good leaders and good team members know how to give feedback directly and kindly. And I think this is my last one. I might have 2 left on it, but essentially being courageous and being able to have enough courage to be vulnerable, which I've already been adding in these pieces in because it's probably one of the biggest thing in the literature for compassionate leadership. Being vulnerable is what takes you to the next level. And it's interesting, they've done a study on, they had heart rate monitors on individuals and they got them to do uncomfortable things. And after 8 seconds, actually, that initial like flight or flight response and that change in your heart rate and that surge went down after 8 seconds. So it's uncomfortable to deliver the challenging information, but that starts to wane after the 8 seconds. So be uncomfortable for 8 seconds and then it can get better. And if you're really needing language to work through a challenging situation and someone's resisting, like I need to bring a patient here, or I need to transfer a patient, or I need to admit this patient, you're getting resistance. You can say, use cuss language. I can be direct but respectful doing that. I am concerned that my patient isn't doing well, or I am uncomfortable that if I keep this patient, they will do poorly, or this is a safety issue or a safety concern. So I can be in those tough situations, advocating for my patients and speaking up. And one person brought this up on a course I talked about. Remind yourself that silence is harmful. When you know that something is wrong and you're afraid to speak up because no one's created a safe place for you to do it, that is hard. But if you can have the courage to speak up because it's the best thing for the patient, that will be a better outcome for them. So asking for help is acknowledging I'm being vulnerable. It's okay. I can't know everything, but I have the courage to be vulnerable and I have the courage to ask for help. Simon Sinek has done some really great research about vulnerability and looking at establishing trust in your team. And it looked at performance versus trust. And time and again, when studies were done, people wanted the person on their team they could trust. Now, obviously, we want a good performer, but we know when we're new in practice, we're not going to have the best skills because we don't have the experience yet. But if you show up with the team and you say, hey, I'm new here, I'm ready to learn, I want to work with you, I want to learn from what you know, I'm going to try my best, you establish that trust and people will pick you over and over again and really shift from that shame and blame. It's a shame and blame. We don't need to know everything. It's okay if we put ourselves out there and acknowledge this isn't something I'm comfortable with, or I'm not familiar with this. Let's work through it together and not say, you should know this. This is like an expectation, which happens all of the time. And really that's leading into having the courage to create psychologically safe environments. Hopefully you've heard of this term. Many people thought it was kind of like the soft skills before, but it is absolutely so important. To have a psychologically safe environment, you need to create a space where people can be their authentic self, that they can have a voice and speak up, and that you permit mistakes and then we can learn from our failure. Now, it's not an environment like business where you say, hey, go spend a bunch of money, and if you lose it all, that mistake, it's okay. We obviously are working with people's lives and we don't take, risks that are inherently too risky for the patient. We balance it with what's the best outcome for them. But sometimes our options are not ideal and there will be mistakes that happen even when we try our best. But we need to create a space where people know that they are safe when they make a mistake and acknowledge it is hard what we do. Does anyone on the team have any thoughts or anything they wanted to say? Have I missed anything? Really can allow to open that safe, psychologically safe environment for the team. And we are at just our last slide where we're checking in with that shift from, before I get to that last slide, is there any comments in there, Brianne? Sorry,
yeah,
I'm trying.
That's okay. There are a couple of questions and comments. One of the questions, it can be hard as a physician to focus on the importance of being kind when there's no accountability for the person you are caring for or their supports to be kind back. So it feels unilateral. How can you prevent resentment for an unbalanced interaction?
That's such a great question. So I would say that we have to bring ourselves to the situation and we don't want to change who we are because of the person we're interacting with. I think at the end of the day that if we allow ourselves to get that resentment, that frustration with the person that's not caring for themselves, it's just going to eat us up. But I agree, it is okay to say to a patient, like, I want to help you, but I need you to help yourself too, right? Like, I think speaking the truth, you can still be directive and kind to your patient, right? We don't need to beat around the bush and pretend that we're not going to say what the situation is. But I would say in those cases, it's, I want to help you, but I need you to want to help yourself too. And then maybe then you're speaking your truth in that situation and it won't feel as frustrating when you're going back and forth picking up the same patient or the repeat offenders. It's probably the wrong language to use, but the repeat person coming in and being honest, like, I'm finding it hard to help you right now because I'm not feeling you're helping yourself. Help me discuss that with you. Like, that might be some language that would help. I don't know if that is helpful for you, whoever put that question in there, but maybe it's a different way to frame it. Was there another one, Brianne?
Yeah, there's another one, and I'm going to paraphrase a bit, but it's basically wondering, based on your research and understanding, the best way to reinforce the importance of resilience building or changing the culture with all this kind of information, and in the practices you are talking about in careers such as EMS, policing, and fire, where it might not be culturally as acceptable or there's still a stigma surrounding it, and especially in older generations, resistance to adapt to new ways of keeping them mentally, emotionally, spiritually, and physically capable of doing their job.
So that's really a great question. And I actually have taught this for sports teams, and I've always got different questions. Some of them have come up there even, and there's this perception that you have to be tough and as an athlete too. But I haven't taught to police or fire. Would love to get out that way for sure. But I would say in those situations that we have to create that, you know, a good leader is vulnerable. Like when I take people to do winter warfare training in the military and everybody gets frostbite, I don't say that, hey, it was really crappy for me last year, we're all going to go do it again the same way. That is poor leadership. I want to be a good leader, so I'm going to say, hey, it was really crappy to do it this way. I don't want it to be as crappy for you. I'm going to make it better for you because as a leader, I'm looking out for you. I think within the cultures that we're working in, it's just acknowledging that it's okay to be able to say I don't know, because I'm actually being the best patient advocate I can be in that situation. And I think saying resiliency skills, it's just like, I'm going to make myself capable of handling more stress. How is that not a good thing? Like I am going to make myself learn strategies to make myself more effective, because I don't want to only thrive in my workplace, I want to thrive in my home life as well. So these are skills that I need to utilize so that I can be the best person I can be. But I always like to throw back to people like, what's important in leadership? And because people don't talk with that language. So I say, if I want to be a good leader, I'm looking out for the team. And I want to acknowledge that I want to make it safe enough for people to say that I don't know everything. So if I, as a leader, can lead by example and say, I don't know everything, I'm going to make my team feel safe enough to say that. So by being vulnerable, I'm actually being more courageous and a better leader, in my opinion. Hopefully I answered that. That person, please reach out to me. I'd love to speak more to that. And that last slide, sorry, because we're at time, was just, which I think is an important slide, and I'm so sorry. It's essentially shifting ourselves into more of a check-in. People get kind of overwhelmed with the word debriefing because that's what you use in evaluation going through training. So what we want to do after a negative outcome or a code situation, we want to check in with the team. Let's say you have learners there or newer people, like talk to them about what you've just dealt with. Create that supportive and safe environment, very team focused, and A is the most important thing. Acknowledge the experience. This is hard what we do. This is not normal that you have to deal with, you know, resuscitating a pediatric patient. This is challenging, and saying, this is hard what we do. Thank you for showing up. If you are feeling overwhelmed by that, that is normal, or that is okay. Reach out to these resources or come talk to me. If you only have 10 seconds in the emergency environment, acknowledge the experience, talk to your team, call it what it is. That is good leadership. That is being a good team member. And I hear this from learners all the time, that they're like, I guess it was normal that we had to resuscitate that patient and everybody was screaming because no one said anything afterwards. And then that leads us, if we have time, and you can use this approach with feedback as well, get them to reflect on the situation. So you're like, how did you think, or how do you feel that went, and why? You know, I felt really overwhelmed, you know, resuscitating that pediatric patient. You know, why? Well, I have a 5-year-old at home, and it like reminded me of that situation, and I was so emotionally overwhelmed. Well, what's your takeaway? This has nothing to do with your clinical performance. It's, I don't need to evaluate that right now. You just had a traumatic event. The takeaway might be, when I experience a patient code or I have a stressful interaction at work, I need to talk to someone afterwards. I know on those days I need to talk to my spouse, or I need to call someone who's my friend, or I need to work out, or I need to journal, or I need to listen to some music, or I need to have a bath, whatever it might be. And someone else might say, hey, my takeaway is I don't feel comfortable with pediatric traumas, so I'm going to take a bit more training in that. That's okay too. They can acknowledge that. But this check-in is not to see what you need to improve, like that you don't know how to do this well or not. It's about checking in with your team, and it's creating that safe, psychologically safe environment for your team to be able to grow and feel safe in the challenges and the work that we do. I will stop talking because I am over. And I thank you so much for the opportunity to join you. I wish I had 5 hours to go over all this with you, and that we could do simulated scenarios. I've made tons of videos that are on YouTube. I can send them to you, where you can either be in a conflict with a peer, with a patient, multiple interruptions, a code situation, lots of different ones where you can practice using these skills and then feel confident, hopefully using them in practice. So I will stop talking, like I said, and if there's any questions and anybody wants to stay after with Brianne, I will answer those. I wish you could see my daughter. She's now in here smiling at you all on the screen, but you can't see her unless I can figure out how to share the camera. Let's see. There we go. It's always great to end with Shaylee.
Thank you so much, Stephanie. And just a reminder, if anybody wants to watch this presentation again, or if you think someone else might benefit from watching this, this will be available on the Trauma Nova Scotia website. But thanks again. That was wonderful.
Thank you, everybody.